So welcome everybody to Workshop 1, Introduction. So this is the first workshop of Introduction to Mental Health Issues. And in this workshop, this lecture I should say, we're going to provide an introduction to what the unit's all about. This will include an overview of what our learning goals are. We're going to talk about the assignments that are due. And then we'll really get into the content, provide some different models of mental health and mental illness, and talk about the role of counselling and counsellors in relation to mental health and mental illness. So here are some of the aims of the unit: to provide you with an understanding of different assessment techniques that you can use. And this includes things like the initial interview and also a range of different measures. We're going to talk about the impact of mental health issues on families, and there are some readings and videos and some content in across a number of lectures where we'll discuss those issues. We're going to look at practical techniques that you can use to support clients with common mental health issues such as anxiety, stress and depression. A big part of this unit is also to look at the limitations of counselling in relation to specifically severe symptoms of mental illness, which brings us to point 5 here. We're trying to also teach you how to identify when symptoms are too severe and who to make a referral to if required. Finally then, to talk about those procedures around referral and how to communicate well with other professionals. So while undertaking this unit, there's a few activities that you'll need to be completing each week. First of all, to complete the readings, and there is an online reading list which lists 2 to 3 readings each week. Most of these are quite short, some are videos. It should be quite achievable. There's a study guide which includes a number of practical activities and short question and answers to complete. There'll be an online lecture, which of course this is the first one you're reviewing now. And there are also additional resources on Moodle too. We don't expect that you'll necessarily complete all of these, but they are there because they can help to improve your learning in this course. We also expect you to complete 2 assignments, which I'll talk about more in a moment, and attend some intensive workshops as well. So let's talk about the assignments. For assignment 1, you're required to select one of these really common mental health issues, and we would like you to research materials related to one of these issues which you can select, and we want you to write a short essay and also to develop a handout that you might give to a client. So what this is really assessing is your ability to research an issue when a client presents with it, and also your capacity to communicate information to your clients about that particular issue. So within the essay component, you're required to follow these steps listed here. So beginning with a definition of the mental health issue, describing how individuals might present with the issue, and by that I mean what symptoms would they typically present with. Then discussing what aspects of this issue you can address as a counsellor, and what symptoms would indicate that a referral is required. So essentially, what are the severe symptoms that act as warning signs to you that say, you know what, this is more severe than I'm able to support the client with. And then point 4 here, assuming a referral is not required, I would like you to talk about the kinds of counselling techniques that might be helpful. You don't necessarily have to list specifically what you would do step by step, developing a treatment plan as it were. You don't have to do that, but I do want you to refer to research which shows that these sort of techniques may be helpful for clients dealing with this particular issue. Throughout the essay, we expect you to not only refer to relevant research, but also to be critical of the research too. And that means choosing your sources carefully and explicitly commenting on what the strengths and weaknesses are of those sources. In an appendix, we would also like you to include your completed study guide for the week that this particular mental health issue is addressed. So if you are looking at depression, we would expect you to include your study guide for the week on depression. And partly I've included that to sort of check that you have been completing the study guides. In the second part of assignment 1, you're also required to develop an A4 handout that you can give to a counselling client. I'm really trying to assess here your capacity to communicate information about a mental health issue. And I really hope as well that at the end of some way through this unit, after assignment 1 has been marked, that students are willing to share their handouts, and I can create a folder on Moodle so that you can look at how other people have tried to communicate issues and potentially use these handouts in your future practice as a counsellor. So within this handout, I would like you to discuss what the mental health issue is, the symptoms people might experience, the causes, the common kinds of causes that research suggests leads to this mental health issue, how the issue is normally addressed in counselling, and what are some of the severe warning signs which should mean that the client seeks support from their GP. So assignment 2 involves 2 tasks. The first part is asking you to read the feedback from assignment 1 and just write a really short summary, a short paragraph, just outlining how you'll use that feedback to improve your counselling practice. So perhaps the examiner of your assignment will point out that you might need to be aware of these particular symptoms, or this particular measure is helpful, or perhaps to consider more recent research on counselling techniques. And so you'll just write a short paragraph saying how you'll do that and how that will improve your counselling practice in the future. The larger part of the assignment then asks you to watch 3 videos which are available on Moodle, and these are videos of people describing their experience of mental illness. What we're asking you to do then is to select one individual from each video and answer a number of short answer questions, and they'll be about 250 to 300 words each. If the individual you select doesn't provide specific information related to one of these questions, we're asking if you could consider what other symptoms might be relevant, or what other presentations or what other kind of supports might be important to discuss. So the specific questions we're asking you to answer are just listed here from 1 to 5. So this assignment is sort of just a question and answer. It's not an essay. And in that sense, it's perhaps a bit easier to do than assignment 1, but it's a pretty good approximation of how you might evaluate a client when they present to you in counselling. So we sort of hope that it helps to assess those skills, which you would also be developing whilst learning in this unit. And we've uploaded quite a lot of resources about assignment 1 and 2, which are in the assignment 1 and 2 resources folders. Please read the instructions really carefully, available from the unit guide. Read the marking criteria and the rubric, and what we've also provided is an FAQ, which lists all of the questions that students have asked over the last so many years, and responses that we've provided. So after looking at these documents, if you still have questions about the assignment, please ask in the assignment forum, and we'll get back to you as quickly as we can. So for all assignments, they need to be uploaded to Moodle, and the word count is plus or minus 10% of that listed in the unit guide. Both assignments should be in APA style, This is excluding the handout, however, because there is no APA style for handout. There's an APA style guide available on Moodle, and there's quite a few different links we've listed there that will be helpful. We're also asking if you can upload your assignments in PDF format. Now, the main text for this unit is Psychopathology Foundations for Contemporary Understanding. It's a recently published text, and whilst the focus is more on severe issues, we still think these are really important to know so you can identify boundaries of practice. It's, I think, a really solid conceptual basis that'll be helpful for your work as a counsellor. Also, please note that you can view the text for free through the Monash Library. You can also purchase a copy of the text if you wish. And there are other readings which you can see from the reading list on Moodle. And these readings include videos, articles, and book chapters. So, as I mentioned earlier, each week there's also the study guide to complete. It begins usually with short answer questions and simple tasks to complete. I actually sort of hope that if you can do this each week, you'll end up with a compilation of resources that you can use for your future practice. Because a lot of what we're asking you to do, for instance, is to find somebody you know or close to you, or somebody you could contact that's a GP or psychiatrist that might be helpful to make referrals to in the future. In assignment 1 and 2, we also ask you to include part of your study guide. So it's important to complete certain weeks in particular. So the whole idea then is that the study guides assist you putting your learning into practice and using and developing resources that you can use in your future work as a counsellor. Also note that Monash has a disability support service, so if you have a disability that impacts on your study, we would strongly encourage you to contact the Disability Support Service as soon as possible. I'd recommend not waiting until an issue becomes a problem and calling or emailing the support services in advance, and that way they'll tell you if there's anything how they can help basically, and make your studies as best as they possibly can be. It's important that I also talk to you briefly about our extension policy. So you can be provided with an extension of up to and including 5 calendar days. If you wish to apply for an extension, you have to submit a request via the extension request link on Moodle. Accepted circumstances are short-term illness, unforeseen employment, and family circumstances. If you need an extension due to exceptional circumstances for more than 5 days, you will also need to follow the special consideration policy. You also have to apply for this no later than 2 days after the due date. And again, for what we're in this unit, for all extensions, please click on the extension request link on Moodle for more information. And that tool will talk you through what you need to do. So no doubt in this unit you will have a lot of questions about course content. If I could ask you to please ask questions in the content questions forum on Moodle rather than sending me an email personally. And this is because if you have a question, there's no doubt that several other students also have the same question, and it's great if they can also see the same answer online, and it also helps to create sort of a shared learning community. If you have any questions specifically related to the assignments, if I could ask you to please ask in the assignment forums under assignment 1 or 2, and again it means that anybody who has the same question is able to see the same answer. So let's talk about what a mental health issue and what mental health actually is. When people talk about mental health, they're usually referring to a person's condition, particularly in relation to their psychological and emotional well-being. A mental health issue then is something which impacts on somebody's emotional well-being. So, for instance, something like stress, relationship difficulties, medical or employment problems. Mental illness, in contrast, is a little bit different, a little more clinical. So, first of all, if we understand illness to be an abnormal, unhealthy condition, we can appreciate that a mental illness then is a clinical sign of personal distress, something which is abnormal, some kind of impairment, and something which might increase the risk of injury or death due to some kind of malfunction. You can see then the difference between how we think of a mental health issue and a mental illness. A mental health issue is much more about those common issues which might impact on somebody's emotional well-being, whereas a mental illness is really just saying this is something abnormal. It's perhaps an indication of something medically wrong, and something which perhaps, as we're going to discuss, can be diagnosed and treated in a medical sense. We might conceptualize mental illnesses as simply illnesses then that affect the mind or the brain, in that they can be diagnosed, they're abnormal, and they require specific treatments. At least that's one very specific medical perspective of what mental illness is about, and it's certainly not the only perspective. Some examples then of mental illness include things like panic disorder, major depressive disorder, and schizophrenia. And there are a whole variety of others which you can probably think of as well. The concept of mental health and mental illness are not necessarily opposites. Somebody might have a mental illness, but they could also have really good mental health. Take, for example, let's say somebody has a medical illness such as diabetes, and they may live a very healthy lifestyle. This kind of person, we can say, you know what, they have a medical illness, however, they live a very physically healthy lifestyle. In the same way, somebody who might be diagnosed with bipolar, for instance, a mental illness where symptoms can range from elation and mania to depression. This kind of person might be, they may have that diagnosis, but they can also live a very emotionally happy, psychologically healthy way of life. And so you can have somebody there who has a mental illness, but also very good mental health. However, individuals who do live a healthy lifestyle, of course, are less likely to become ill. And people who live a really mentally healthy life, have good contact with social relationships, good family relationships, they're also less likely to suffer from mental illness. So mental health and illness are related, but they're not the same. And we can't really assume that just because somebody has a mental illness that therefore they're likely to have poor mental health. This diagram here, just on the right, helps to think about that distinction and those four different categories then that we might think that people can fall under. People with optimal mental health with mental illness. So, for instance, somebody who, such as we spoke about before, who has bipolar, but also healthy social relationships. Somebody who has optimal mental health without mental illness, so no signs of mental illness and also a lot of protective factors. People who have poor mental health without a mental illness, so these would be people who might suffer from a lot of stress, employment difficulties, and maybe poor social relationships, but there's no symptoms of mental illness. and then individuals who would have a diagnosis of mental illness and also a whole range of negative mental health issues. Throughout this unit, we tend to follow a conceptual model where we understand mental illness as not necessarily a categorical thing where you do or you do not have a mental illness, but we think about categories of symptoms such as depression and stress and relationship issues, and we think about those on a continuum from mild to severe. And so when those issues are really severe, this is when we tend to say that the individual might require treatment, whilst if it's mild or moderate, they may be more amenable to counselling and the kind of professional services that we can offer. This continuum model is pretty popular, but it's a little bit in contrast to a specific medical model which suggests that mental illnesses are either there or they're not. There's also different philosophical perspectives about what causes these mental illnesses, and these different philosophical perspectives relate to and result in different suggestions for treatment, which we'll talk about a bit in a moment. This table, taken from page 9 of your textbook, provides a really good overview of the different philosophical perspectives towards mental illness and mental health care. We're just going to talk about a couple of these in a little bit more detail. So the biological model, also known as the medical model, argues that mental illnesses are caused by or mediated by physical changes in the brain, and because of that, therefore, treatments are also physical. Predominantly, therefore, a client presents to a GP with depression. The GP conceptualizes the depression as a physical change in the brain and offers a remedy that will therefore change what's happening in the brain to treat the patient. In contrast, the CBT model, cognitive behavior therapy, one of the more popular models of counseling, this model argues that our early experiences and automatic thoughts that come up in the brain result in poor mental health. And therefore, treatments are usually about changing the way people think. And if we can change the way people think, we can change the way they feel and the way they behave. The stress model argues that social and cultural issues cause stress, which can result in poor mental health. And therefore, interventions are usually about changing the social and environmental conditions. The family model argues that family relationships can be really unhealthy and the family can be conceptualized as a unit. So intervention is often about bringing the whole family together to try and improve communication and therefore improving the health of the unit and the individuals within that unit. So you can see just from this brief discussion how the way people make sense of a mental health issue therefore impacts on the kinds of therapies that they think are going to be helpful. So let's talk now about what counselling is. Some of the readings I've selected for this week are about why people choose a counsellor, and understanding of this field might be informed by the etymology of the term itself. Counsel comes from the Latin consilium, which means to provide consultation or advice. It's a little bit different then from the sort of biological or medical model which suggests that the client is a patient who comes for treatment. We're not here therefore to treat patients with illness and to make them well. We're here to provide consultation and to use the best of what the client can offer to improve themselves. So I've put together here a few definitions which help to describe what counselling is. Important to note, however, that this is about how counselling is commonly conceived from a Western cultural perspective. And these definitions really highlight how counselling as a process tends to support people with normal developmental processes, helping normally functioning and healthy individuals. So in summary, I think we can think about counselling as an act of providing consultation to individuals, couples and groups to help them manage normal developmental processes across the lifespan. So counselling can be really helpful for helping most people overcome a whole range of normal developmental difficulties that they might experience. Counselling can help people develop insight, relate better to others, develop self-awareness, problem-solving skills and healthy behaviour patterns, empowering people to take control and make changes, and developing a greater sense of meaning and purpose. These are issues which I think are often missed by psychologists and psychiatrists because they tend to focus on the abnormal aspect of the individual and how to make that person normal. We're not doing that so much. We're focusing more on how can we really improve the lives of people who have normal developmental difficulties. And that actually gives us a much larger scope of practice, a much wider range of issues through which we can support people with. I've just listed a question here at the bottom for you to pause and to think about what other kinds of issues do you think that counselling can help somebody with? And hopefully you can think of at least 2 or 3 that might be helpful. So we've spoken a little bit about what counselling is, and it's important also now to talk about what counselling is not. Counselling is not about diagnosis. This is what GPs and psychiatrists and psychologists tend to do. And the reason for that is diagnosis comes from that medical model which defines whether people are normal or abnormal. We're not so much interested in doing that. We're here to support people with normal developmental issues achieve the goals that they want for themselves. Diagnosis also requires a really comprehensive understanding of symptoms, related medical issues and assessment. And that's not really the focus of counselling and what counsellors tend to do. Counselling is also, therefore, not really about treating mental illness. Counsellors might, however, support clients with mild and moderate symptoms of mental illness. Actually, treating severe mental illness requires a really comprehensive understanding of the client's diagnosis, evidence-based strategies, medical assessment to ensure the condition isn't caused by some kind of physical condition, and often also an appreciation of how medication impacts on the individual. So I thought it would be helpful here also to talk about the expectations we have of students once they graduate from our course, and they're in line with the expectations of the Australian Counselling Association scope of practice. So these are the capabilities that we would expect students to have to work with clients on a range of personal and psychological issues, providing counselling, referral and advocacy, delivering approaches which support individuals with low to moderate needs, so not severe needs but low to moderate issues, delivering early interventions programs, providing case management, referral, providing information to professionals, and again working with consumers with low to moderate needs in primary care settings. So I think what we're doing here in this course is entirely consistent with the expectations of what counsellors are expertly able to provide in the community. This figure here I think is really helpful because it helps to show the scope of practice that counsellors have relative to similar professions. So you'll notice there's a fair amount of overlap, and in fact there's probably a little bit of overlap between clinical psychology and counselling, perhaps more than shown here. But you'll see as well, so counselling is more about those moderate and mild normal developmental issue that individuals experience on this sort of wellness continuum, whereas psychology and psychiatry are far more about the severe issues that individuals would experience. The model, this figure also indicates that counselling has a far greater scope of practice, so there's far more issues that counsellors would be able to support individuals with, a greater scope than I would suggest psychology and psychiatry. And whilst we might train counsellors to assist people with mild and moderate issues, that's not to say that you may go on to do additional training and courses which would then allow you to support clients with more severe issues. So that kind of training might include professional workshops, short courses, or perhaps you'll go on to do additional qualifications. So that will be up to you, and it's not to say that counsellors are completely unable to support people with severe issues, but that's not the kind of training that we're offering. In the future, if you wish to work with clients with more severe issues, there'll be opportunities to do professional development that will provide you with those skills. So in this unit, we will teach you how to assist clients with mild and moderate symptoms of mental illness. We'll also learn how to identify those severe symptoms that will require a referral. We'll do this by week. We're going to discuss a category of a particular mental health issue, such as depression, stress, anxiety, relationship issues, and abnormal, atypical sort of issues. We're going to discuss how to support those clients with the mild and moderate symptoms and what those mild and moderate symptoms are. And then we'll talk about sort of towards the end of the lecture how to identify the severe symptoms that require referral. Now, what I've developed this year is a particular model that will help you make the determination about whether the symptom is mild, moderate, or severe. Let's take a look at that. So this is the suitability for counselling model. You can see across the top here, I've developed categories of symptoms, including depressive, stress, anxiety, addictive, relationships development, personality, atypical, and other. And within each category, symptoms are listed from mild to moderate and severe. Many of these symptoms are taken from a very careful review of the major diagnostic models available. The symptoms listed under mild and moderate, we are suggesting are likely to be suitable for counselling, and there are many more besides what I've listed here. However, all of the symptoms listed under the severe category indicate the likely presence of a severe mental illness, and when clients present with any of these symptoms, we would strongly encourage you to make a referral to a GP or a psychiatrist. At the very bottom of the table, you'll see I've included a note here which specifies that some of these symptoms require a time duration, which are listed next to the symptom. And I've also noted how the symptoms are based on the DSM-5 and ICD-10, which I'll talk about later. So I'm going to refer to this model throughout the unit to provide some direction about how to make the determination of severe mental illness. And I really hope that this model makes it much easier for you as a counsellor to say, you know what, this is well within my competency, I can certainly help this person with the symptoms they're describing, or perhaps to say, this client is presenting with hallucinations. This is a severe symptom and they probably require an assessment. Although we've said that counsellors tend not to make diagnoses, and it's not something we offer training in, it is helpful to know how mental illness diagnoses are made, because in all likelihood you'll have many individuals referred to you who you see who do have diagnosis or have likely diagnosis. So diagnoses are typically made, as we said, by GPs, psychiatrists, psychologists, among others. And essentially what this practitioner does is to compare the client symptoms with the criteria listed in either the Diagnostic and Statistical Manual of Mental Disorders 5th edition, developed by the American Psychiatric Association, or the International Classification of Diseases 10th edition, published by the World Health Organization. So when an individual's symptoms meet that criteria listed in either of these texts, a diagnosis is confirmed. There's usually a whole range of background and health information that has to be acquired as well, and a whole range of issues that have to be ruled out, including things like current stresses and adjustment, substance use and medications. So some diagnoses are very difficult to make and take a lot of time, take a lot of assessments and collaboration with other professionals to be sure, particularly things like developmental disorders and personality disorders. You'll see I've actually listed the ICD-11 here, and on the previous slide it was the ICD-10. That's because an ICD-11 is coming out very soon, so I just want you to be aware if you're looking for the ICD-10 in the future, it's going to be the ICD-11 very soon. So although we've said that counsellors tend not to diagnose or treat severe mental illness, counsellors still play an important role in the lives of people who may have severe mental illnesses, including things like referral, working collaboratively with other professionals, assisting people coming to terms with diagnosis and stigma, and also really importantly, supporting people with a mental illness towards normal developmental goals. Psychiatrists, psychologists, GPs tend to focus on treatment goals and resolving those abnormal symptoms, and to some extent that's justifiable because that's their role and there's very limited time. Counsellors, on the other hand, can really help individuals focus on positive development, which can actually protect them against a reoccurrence of severe mental illness in the future. A significant part of this unit is trying to determine whether somebody may have a severe mental illness or not. And there's a whole range of ways we can do that, aside from the using the suitability for counselling model. For instance, asking the client whether they have a previous diagnosis, whether they've seen a counsellor or a psychologist or psychiatrist before. Also important to be aware of what severe symptoms are and listening carefully for those when the client discusses what's going on. And in particular, the initial interview and assessment that you do with a client. Although our kinds of assessments and interviews aren't intended to diagnose, we can be alert for those severe and extreme responses which might require further assessment. A big part of the next lecture is going to be talking about how to do that initial assessment, and when I come and visit, we are going to spend some time practicing doing that assessment on each other, not using personal issues, but just a role play that will really help to make you feel confident about doing an initial assessment when you're working as a counsellor. When a client is referred to you by another health professional, usually you'll have some information about the client which may indicate whether mental illness exists on a referral letter. You may also find that at some point during your counselling with a client they may start to show symptoms of mental illness, which is why this unit is really alerting you to what those severe symptoms might look like so that you can make a determination and referral when you need to. So over the course of this unit we're going to consider a whole range of mental health issues and how to address these in counselling, specifically the mild and moderate issues. We're also going to consider the difference between the mild and moderate issues and the really severe symptoms. The severe symptoms are the ones that you need to be aware of because they tend to indicate referral is required. And referral is required because the severe symptoms don't respond well to short-term counselling. They tend to respond to medication and long-term specialist psychotherapy. We'll also talk about assessment measures that can help you to determine severity, and we'll also use case studies to help you identify symptoms and use appropriate counselling techniques. I think we'll use the case studies when I come to visit, and we'll use them in the workshop because they provide a really helpful group learning activity. But I think you'll find that this unit includes a lot of really exciting and interesting content that really improves your capacity and ethical responsibility as a counsellor. And there's a lot of practical activities that we're going to use that you can use with future clients. And I actually, at the end of the day, I think you'll feel really empowered by the kind of learning that you'll undertake here. So I hope you enjoy the rest of the course, and the next lecture I present will be on our initial assessment primarily.